Okay, thank you, the nurse break, for letting me tell you something about what it means to be a clinical nurse educator. So, hey, my name's Benny. I'm a clinical nurse educator in emergency. That's my background. What is a CNE? A clinical nurse educator is somebody who, I guess, has a lot of clinical presence. It's somebody who works on the floor with other nurses to help them in their job and assist them in learning and training purposes. What does a CNE do? On a day-to-day basis, it can look very different. In an emergency setting, a good example, one day I may be working in resus with somebody who's a newly trained resuscitation nurse. The next day I could be working at triage, training somebody. ED specifically has certain training pathways or platforms. So it may be working in the fast track area. It may be teaching people how to use nitrous or gas. It may be working alongside new graduate nurses for a week. It looks very different, especially in ED. It's so diverse because we work in different areas of an emergency department. I work in a mixed emergency department with adults and children. So it can look very different, and it can be simple stuff like attending meetings, looking at new ventilators. I've got one behind me. So, going through how do we use it? How do I train my staff? What are other people in other facilities using in relation to that? Basically, how long have I been a nurse? I've been a nurse for about 10 years. My background is in trauma. I love trauma nursing. I love emergency. So I've been doing that for about 10 years in total. How do you become a CNE? I think it depends on where you work. Sometimes in other areas, you can become a CNE after a few years of working on the floor. It really depends on your specialty. In ED specifically, because it's so broad, you generally should do probably like 5 years at least minimum. For me, it took me maybe 8 years. I did go off and specialize in trauma. So it took me a little bit longer. And I guess in ED, you don't know what's coming through the door. So it's good to be well-rounded. I had to understand peds and adults and to be proficient in both, not only to know the knowledge, but to be able to teach it, which I think is important when it comes to working in ED. I've worked at a few different hospitals, but I really love it. The next question, what are the most common questions you get asked? Sometimes help. Can I have some help? I think that's one of the questions I get commonly asked. Can I have some help? And I love unpacking it with somebody. I guess a lot of people say, what does a CNE do? And it's really hard to explain that sometimes you're in the office one bit, the next minute you may be, like good example for today, 1 minute I was in a pediatric meeting online with 4 consultants and 4 CNCs. The next minute I was on the floor actually externally pacing a patient who had come in with bradycardia, who had a bradycardic arrest. So that was awesome. I got to have hands on, and then I could do some other stuff as well, which is really good. I guess that's one thing. Another thing, what concept, what are the most common questions you get asked? Yep. What concept do you find the hardest to teach? I think that for me, to be really honest, it's when people are not motivated. I find that a hard concept. When someone doesn't care if they don't know something, that's hard for me. I'm a highly motivated individual, so I find it hard if someone's not keen to learn something. I can teach skills. I can't teach you to be motivated. That's intrinsically motivated. I guess, what does a typical day look like for me? Generally, I do 12-hour shifts, 3 of them. So get here at 7. We do a huddle, especially COVID. PPE is big time. We're getting a fair few COVID positive patients coming through our door. So it's about just making sure we're wearing all the appropriate PPE. And then it might be looking at the allocation book. We're organized in terms of we know what we're doing a month in advance. So, I'll know that I'll be working in resus with a staff member. So I'll head to resus. We'll get handovers on patients and work, with patient care alongside them. However, as a CNE, you do get interrupted on a regular basis. And it's about being available for people as well, but letting them understand something, not doing it sometimes myself, but teaching it, or letting them teach me if they know something as well and I don't, which is really important as a CNE. What are some things behind the scenes that people may not realize that I do? I guess, we look at some of the IMS or clinical incidences as well and find out what's been done. I try to work out, could there have been a way we could have prevented something? Is there something, is it related to a knowledge gap, or is it related to just a mistake? Other things are ensuring that people, you know, it's fair and equitable, that people are trained. Also for me, I try to put out a fair bit of content from videos, and try to make it relevant to people so they can understand what's happening. You know, good example, pacing. I'd put a video a day before about pacing. So people go, oh, that's pacing, and we could do it, you know, hands-on sort of stuff. I just don't think people realize that when you've got a big department, especially ED, maybe 130 staff, that it's really hard to sort of, you know, manage your time well. I guess, one thing you wished before you knew in this area, I guess, you never really get a break, kind of. But just how torn you are between the clinical and non-clinical stuff, that's really hard. The challenges and negatives of being, I don't think there's negatives. Hey, I'm lucky. I love my job and I really enjoy it. So for me, I don't think it's a negative. The positives are that I actually get to talk to patients, and then I'm free to help people and see them learn stuff. And I reckon that's awesome for me. What is my favorite topic to educate on? Oh, I love trauma. That's the thing I really like. I love teaching on trauma. I love teaching on ventilation. I'm excited to roll out this new vent that we've got here, the Hamilton. Really pumped. I've been reading on it. I'm really keen to get it out there, which is good. And I love teaching on the respiratory system and especially trauma stuff. What red tape or barriers to improvement in your field do you want to see reduced or removed? I think it's really hard. I want to make more videos and more content that's actually patient driven. So a good example, like popping in the shoulder, I want a video on how to do that. You know, stuff on medications and stuff. I really want nurses to have access to that. I've developed like a resource package for my nurses. But I think we're in a very visual world at the moment with social media. So learning how to gauge that without causing sort of harm to patients is something that I really want people to know. I want to see, I guess, staff become more skilled to do more skills for our patients, if that makes sense. And I think that's it. I think if you want to be a CNE, other things and how you sort of study to become a CNE, most people do like a they can go into a graduate certificate in emergency nursing. For me, I did a master's in higher education and some other things just in higher education from a teaching perspective. But also I did a Cert 4 in training and assessment, which can be used. At the moment, I don't think it's a major requirement for being a CNE, but they do want some postgraduate study experience and definitely some clinical experience. Anyway, that's me. Thanks heaps, guys. Thank you to the Nurse Break as well. If you want to become a CNE, go and do it. It's awesome. Have a great day. Bye.